And we are back here at the Grand Hotel on Mackinac Island, just talking about what a beautiful couple days of weather we've gotten. We're joined now by Dr. David Miller, CEO of Michigan Medicine. Welcome back.
Zoe, thank you. It's great to see you, and I couldn't agree more. This weather's northern Michigan at its finest.
It is. It's good to have you. So let's start with where negotiations stand right now between Michigan Medicine and Blue Cross Blue Shield. There was more than 250,000 patients in Michigan in the crosshairs, but it was announced yesterday you've reached a deal. This appears to end a months-long standoff. What can you tell us?
I think, first and foremost, we're grateful that we have an agreement in place that will support continued access for our patients. That's always been our focus, making sure that the patients who need our care across the state are able to receive that now and into the future. And while there are still some details to be finalized, we're optimistic. We look forward to continuing our partnership with Blue Cross and to supporting our patients across the state.
If I'm a patient of Michigan Medicine with Blue Cross Blue Shield, how should I be feeling right now?
I think feeling good, and we are grateful for all of our patients who trust us with their care, and we feel well positioned to continue that now and moving forward. So as I often say to my own patients, even at the end of clinic, and they've asked me over the last few weeks, I said, we're going to be with you at every step, and we feel that way right now.
Doctor, affordability is such a key word right now. What is Michigan Medicine trying to meet the moment when it comes to challenges of healthcare affordability?
Yeah, thanks, Zoe. I think it's such an important concept and moment, and I think we feel a lot of both responsibility and opportunity there. First, I often think of affordability through the lens of value, right? How do the dollars that we invest in healthcare improve health outcomes, enhance access, make sure that we're providing care at the lowest reasonable cost? And there are a lot of ways that I think Michigan Medicine is well positioned to play a leadership role there. First, I would just say, one is, where are patients receiving care? Are they receiving care as close to home as possible and in the lowest cost environment possible? And just as a couple examples, as we've grown across the state, for instance, in our partnership with University of Michigan Health Sparrow, we've been able to build capabilities in some high complexity areas of care, like neurosurgery, for instance, where now patients who used to have to be referred to Ann Arbor are being taken care of in Lansing, not only closer to home with great quality and expertise, but at a lower cost. So one is, can we help patients get care closer to home in an environment that is often lower cost? Second is thinking really about the continuum of healthcare delivery. We know there are some aspects of disease progression or healthcare utilization that could benefit both from easier access, oftentimes virtually rather than having to come into a bricks and mortar office, and focusing on prevention in the first place. And we see some opportunities to allow technology-enabled care delivery, to allow patients to look at risk factors, help us make the best possible decisions to avoid the onset of disease in the first place. So that concept of affordability, how do you look at it through the lens of value, and how do we as health systems both build our infrastructure to support that and partner with others to get to that greater affordability?
We are talking a lot this week about the House being on fire, these numbers that show reading scores so low, per capita income so low compared to other states. How does the state of the health of Michiganders play into this idea that Michigan as a state is not where it needs to be?
Yeah, thanks. Well, I think, we see our mission at Michigan Medicine as having a statewide impact, our mission of advancing health to serve Michigan and the world, and as a public institution. And we focus a lot on how do we enhance the common good. The example I'll use again comes back to how are we creating access to healthcare services in a way that improves health in the communities we serve. As we've expanded our healthcare delivery system, we've focused on care locally, improving outcomes, and managing cost. I gave you one example that we've used in neurosurgery. Another example that we've been able to take advantage of has been between University of Michigan Health West in Grand Rapids and University of Michigan Health Sparrow in Lansing. Patients in communities in between, in Ionia and Carson City, we've created greater options and lower cost environments for them to receive care. We think that type of partnership, which in many ways reflects new approaches to common ground, are ways that we're going to create better systems of care, ultimately with improved outcomes, more reasonable costs. This doesn't happen overnight, as you know, Zoe, but we've published some of our recent results in the New England Journal of Medicine Catalyst, and we think we're building toward that future state where care is easier, closer to home, measurable improvements in outcome, manageable changes in cost, partnership with the employer community and payers to get there. It's going to take everything we're talking about at this meeting, but we're looking forward to being part of those solutions.
Dr. Miller, thank you so much for the time.
Thank you, Zoe. It's great to see you and really appreciate the opportunity to be here. And my last plug is just to thank our incredible teams at Michigan Medicine for the great work they do every day.
There you go. We're going to take a quick break. We will be back in just a moment.